Hi, this video is the RF hair transplant restoration surgery on a client who has a receding hairline and both temple corner, and basically he has a narrow jaw and with a receding hairline in both temple. It gives him a really wide forehead and a high forehead, large forehead, so that his shape right now is like a V pattern. So our goal is to bring in the temple and lower the hairline to give him more of a parallel shape and really frame the face better. So in this client, if we just lower the hairline without bringing the temple, he's going to have a lower hairline and a wide, just a wide forehead. And that's not something that you really want to do. You always have to have symmetry to it. As long as the temple is not too far back, the hair transplant, especially the hairline, is an art form. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. On average, from the mid-eyebrow to the hairline for Asian and Black is around 6.5 to 7 and centimeter. For Caucasian, around 7.5 to 8.5. Although we use the average height of each ethnic as a guide, really we build the hairline. It's like a custom-built hairline. We build the hairline according to each individual facial structure. As long as the overall proportional from the mid-eyebrow to the hairline is a third, from the mid-glabella to the tip of the nose a third, tip of the nose to the bottom chin is a third. And so what I did, we based on the anatomy. When the patient wrinkle the forehead, the high squeeze, we put a thumb or pinky, and barely above that we run along the line. And then another way is when we talk about the mid-eyebrow to the hairline here is 6.5 centimeter. Okay, it's 6.5. And then we have a midpoint here. On average, from the midpoint to the sides is 7 to 8.5 centimeter. And so for this client, actually exactly 7 centimeter. And we'll put 7 centimeter here. Exactly 7 centimeter here. And we can always bring back a little bit too, but as long as within 7 to 8.5. Here it went up to 9.5 centimeter, and that does make the forehead a little wide. Once we get the shape down, we zigzag, no hairline straight, so we dance up and down. And there's two types of hairline. There's a tight hairline and a soft hairline. The tight hairline has a smaller zigzag. The soft hairline has a bigger zigzag. Once we get the shape down, we will transplant at a very precise angle, around 35, 45 in the front. Changes when you go backward and changes when you're in a different direction. For the temple, it's really flat against the skin and pointed backward. Selection of hair grafts is important. We transplant rows and rows of single hair graft in the front, followed by root of 2 hair, 3 hair, 4 hair, and back with broken volume. And on the temple, we transplant mostly root of those single hair. The other important factor is reinforcement. We not only fill in the bald spot, but we go up and we go out toward the back and reinforce the area that it will be balding and slightly balding right now to anticipate the future hair loss. So that way you have less deboncated line and reduce the chance of actually having coming back. So this is the RF hair transplant restoration surgery on creating the hairline, recreating the hairline, make it perfect. And once you lower the hairline and bring in the temple, the face will change. So this client's been wearing his hair long and put it down forward to hide his forehead. And he's tired of it. What he wants to do is to be able to spike up his hair or comb any way he wants, but without limited to having to comb his hair down to hide the forehead. Thank you.